We are live. Welcome everybody that's coming in. We're going to give it a minute and let everybody have a chance to get into the room. Okay, welcome everybody to our session, Elections and Their Outcomes. Thank you for joining us and supporting our Medicare Summit this year, which we're delighted to bring to you. Please take some time during the one remaining exhibitor hall session to visit our exhibitor sponsors. Can y'all hear me? Can y'all hear me? Because I'm getting but we couldn't do this without our exhibitors, and you can just click on sponsors and then summit sponsors and then click on the logo you'd like to visit. And speaking of sponsors, this session is sponsored by CareSource, Purchasing Alliance Solutions, and Cigna. And first up, we're going to hear from Purchase Alliance's Jeff Fishback. Jeff, take it away.
Thank you, Donna. I appreciate that. Purchasing Alliance Solutions has been helping brokers with the needs of their clients for nearly, well, in fact, for a little over a quarter century. One of our strong points is, which that kind of explains the gray, one of our strong points is our people, each of whom is a specialist in either large group, small group, individual, and senior products. We also have available complete agency services, which allows a broker who specializes in a particular discipline, say Medicare, who might be asked by their neighbor to take a look at their group. That broker can turn to us. We will handle the entire opportunity from start to finish and help that broker to meet the needs of that neighbor and stay in their center of influence. Today, we're co-sponsoring with CareSource. They're, of course, have been in the ACA market this past year and are moving into the Med Advantage market for 2021. They've brought good commissions into the state for us and have been very supportive of brokers. I think they really understand that when we support each other, we all rise together. They're also proving that by investing in programs that provide health education and life skills coaching for low-income communities. Also, they've committed to $3.5 million to affordable housing in Georgia. Similar to that, Purchasing Alliance Solutions continues to invest over $100,000 a year in economic development activities in communities around the state. Those are your communities that we're working in. So as Georgia grows, we believe that the business is going to grow for all of us. Then one final point is we hear people say, I can't wait till we can all be together again. If we've learned nothing else from this pandemic, we've learned how important relationships are. And we want you to know that the relationships matter and that you matter to us and to CareSource. I wish you God's safety and good health, and certainly look forward to hearing from you. Thank you.
Thank you, Jeff. We appreciate your support. Next up is Renee Millstone with Cigna. Over to you, Renee.
Thank you, Donna. I appreciate that. Good morning. My name is Renee Millstone. I'm one of the broker sales managers for Cigna, and we are really excited about AEP 2021. We love this event. We did it last year, and we love every opportunity to connect with our broker community. Like I said, we're very excited about AEP 2021. We hit you guys, actually, our brokers, hit records for the Georgia market last year, and we are excited about this coming year. And what we heard from our broker community is they wanted to see stability in our plans. They wanted to make sure that our plans didn't change from 2020 to 2021, so they wouldn't have to scramble and move their customers. And it would have been even more of a burden this year in light of this pandemic of moving seniors around to new plans. So you're going to be thrilled to know that our plans are stable, and your customers are going to be thrilled to remain on that plan. And they're actually going to see enhanced benefits, not just stable benefits, but actually they've even gotten better. And your new customers are going to be thrilled that they'll be able to get into a Cigna plan that will meet their needs and give them some valuable health care benefits. Just one other thing is we've actually rolled out some virtual and telephonic enrollment tools that will be key to you being able to continue to connect with the senior community and be able to meet safely with them. So if you haven't heard about any of those tools, please reach out to us. Come over to our booth, go on our Producers University, and schedule yourself for one of the upcoming trainings. We'll be happy to help you figure out how to do that if you just want to come over and visit us in our booth. We wish all of you a very successful AEP 2021. Whatever we can do to make it as stress-free as possible, please let us know. Thank you so much for letting us come here today and presenting Cigna.
Thank you, Renee, and thank you for your support. We really appreciate it. Our speaker for this session is Marcy Buckner, JD. Marcy is the Vice President of Government Affairs with the National Association of Health Underwriters. In this role, Marcy manages the association's government affairs team, including the monitoring of activities of all state legislatures, insurance departments, and intergovernmental organizations to coordinate efforts to advance the interests of professional health insurance producers. In addition, she serves as the association's liaison to federal agencies, such as the Department of Health and Human Services, Centers for Medicare and Medicaid Services, Internal Revenue, Department of the Treasury. Marcy is also staff liaison to NAHU's Legislative Management Team, Legislative Council, and Legislative Council working groups. She received her Juris Doctor from New England School of Law in Boston, Massachusetts, and her Bachelor of Arts degree in Political Science and History from the College of Charleston in South Carolina. When she's not in the office or traveling the country speaking at healthcare symposiums, she spends time introducing her rescue cavalier King Charles Spaniel Harrison to city life. And if you pay close attention, you might get to see Harrison. We got to see him a few minutes ago. Thank you for that. Thank you for being here and spending your time with us today, Marcy, and we'll turn it over to you.
Thank you, Donna. And I just want to confirm that y'all can see my screen before I start.
Yes.
Okay, thank you. Well, I am going to talk obviously about the state of the race and how it will affect Medicare going forward into the future. But I do want to touch on a few things before we get there. And one of them is some special emergency rules that have been put in place because of COVID-19. As Jeff said earlier, we are all hoping for the time where we can be together and see each other in person. And so I do want to make sure that I mention some of these pieces. There were emergency rules that were issued that allow for a waiver of the 3-day or 3 midnight rule for observation status or for inpatient status versus observation status. So they're waiving the 3 midnight rule for inpatient status to be required before a Medicare covered patient goes into a skilled nursing facility for that skilled nursing facility or SNF to be covered by Medicare. So that that requirement has been waived during the pandemic. And just want to point that out since it's something that we're asking to be fixed in the longer term as well. And they've also expanded through emergency rules the use of telehealth under Medicare and requiring that providers be reimbursed equivalent to what an in-person encounter would be, since those are not reimbursed at the same level. They've also had a number of other pieces that they've allowed some expansion in special enrollment periods for Medicare during the pandemic, and also in many areas that were affected not just by COVID-19, but also by some of the natural disasters that we've had, the fires, the hurricanes that I know may have impacted some folks in Georgia, are also, if there is a FEMA emergency declared, do qualify for a special enrollment period. And then of course, those that were affected by the pandemic as well. And they've also allowed for some pieces to be waived, an in-person or wet signature, as it's called, for the Medicare application has been waived, and some of the communication measures for agents and brokers have also been waived so that they don't have to be in person and can be conducted over the phone. And if you have more questions about some of these emergency rules on Medicare for COVID-19, you'll see there is a toolkit from CMS that's available there. We also have links to this on the NAHU website, as well as emails that go out every Monday with any changes to COVID-19 rules and regulations there as well. And those do include rules that impact other markets other than Medicare, but that's just what I wanted to focus on briefly as we move into this. And then looking at what we can expect from the different possibilities of the turnout for both the presidential and congressional races, I do want to take a look at what has happened over the past couple of years under the Trump administration, really because during the Republican National Convention in July, President Trump didn't release a platform, which is traditionally done during the Republican National Convention and the Democratic National Convention. So without a platform for the next 4 years, we need to look back at what we have already seen him take action on to see really what we can expect for him to do for Medicare should he be elected. And so one of those pieces was from last year in October when he released an executive order. And I do want to remind folks that executive orders don't have the weight of law. What they do is they encourage whoever is directed in the executive order. Usually it's a federal agency. Sometimes it's asking something of Congress, but here it was directing the Department of Health and Human Services, so HHS. He is asking HHS to take actions on these different items within his executive order. And we have seen a few pieces of this come out, which we'll talk about in a moment, but some of these are still items that are waiting to be acted on. So things like expanding telehealth, they have done this under the emergency rules for COVID-19. And we were also expecting them to expand telehealth for those covered by Medicare for I don't want to say regular times, but to be extended into the future beyond COVID-19. We're also seeing attempts to streamline the approval for coverage and coding processes to be a bit more innovative, to make it easier to access Medicare. This is all in reaction to trying to promote Medicare amongst seniors and also to protect it against a Medicare for all proposal that we're seeing from some folks on the other side, not everyone. So I do want to point out that President Trump is very supportive of the Medicare system and voice that through the executive order. We also had an executive order in September. Oh, and I think I may have skipped over one. Sorry. There we go. I know the slide's like the back of my hand. So we also had some executive orders in July that would affect Medicare, and these are specific to prescription drugs. And in July, he released executive orders, once again, asking, because they don't have the weight of law, but asking HHS to take action on these things. So asking for insulin and other drugs related to diabetes for them to have discounts that are passed down to the consumer. Also looking at ways to re-import drugs specifically from Canada, and doing this for those folks that are covered by Medicare. Looking at possibly doing away with the drug rebating system under Medicare and those Medicare kickbacks. And some of these I know sound familiar, and you're right. There were some proposed rules that were released from the Trump administration, some earlier this year, others since 2016. There was a proposed rule that was released that would have done away with those kickbacks, similar to what's described here in the executive order. Excuse me, but that rule was rescinded. They put it out for comment. They received a lot of comments, including comments from us at NEHU, and we actually met with Secretary Azar about that proposed rule and cautioned that taking away the rebating system or the kickback, the Medicare kickback, without having really a replacement in place could actually cause an increase in cost. So we did want to caution about that. And we did end up saying, like I said, that rule was rescinded. So they took it back to the drawing board. And then now under this executive order, they're redrafting that. So we'll see a new proposed rule possibly later this fall. And then we did also have another proposed rule that was released about that reimportation of drugs, and that we commented on earlier this year. And one of the items there that we raised was just to make sure that by doing so, by allowing that the importation from Canada, that we weren't limiting some of the plans that were already in place that individuals were taking advantage of, that are appropriate under the law for individuals to be able to bring drugs back with them from Canada, and some of the Medicare special plans that we know that are in existence for folks that are using those. And so we, like I mentioned, we did comment on that earlier this year, and since then they didn't rescind the rule, but they are reissuing a proposed rule that will address those things. And then when we look at trying to align drug prices under Medicare with international drug costs, that was something that was included in one of the July executive orders, but he actually reissued that just almost 2 weeks ago. It was on a Sunday, but this is what they're calling the most favored nations executive order, which will become a proposed rule that would use the international drug index pricing to try to regulate the costs for both Medicare Parts B and D. So previously in the July executive order, it only included Part B. And so that's why he reissued the executive order to make sure that expanded to include Part D. So you'll see here through these executive orders, he is seeking to lower the cost of prescription drugs for Medicare. He also signed an executive order over the summer regarding telehealth and trying to boost rural healthcare. And this would expand broadband into some of those rural areas to allow for Medicare beneficiaries to actually be able to benefit from some of those special telehealth rules. So here, really trying to support people who may not already be able to access their care through telehealth. And then shifting over, and I'm going to talk about single payer as an example here for the elections, both on the presidential side and the congressional makeup. And this is because this is probably the single most important issue for the Medicare market and how it could impact the market. And so when we talk about this, I also want to make sure, as much as we are going to use Medicare for all as an example, I want to mention some of the other terms that are used just to make sure that we're all on the same page when we're talking about these different types of plans. And so universal health care, Medicare for all, single payer, Medicare buy-in, Medicaid buy-in, these are all different things. And sometimes these words are used interchangeably, but I want to make sure that we understand what all of these are. So universal healthcare just means everyone has access to healthcare. It doesn't mean everyone has it. It just means that everyone has access to get into a plan. Single payer is similar to what it sounds like. There would be one single government-run payer for plans to go through. And because there's one single plan, there aren't private carriers that are participating in this. So this is different than Medicare for all, where, as you all know, there are private carriers that participate in Medicare. But this would still affect the Medicare population quite differently if it is to expand, and we'll talk about that in a minute. Medicare buy-in would allow different populations to buy into Medicare, so not everyone, but certain groups. Public option would allow for government negotiated rates to be run through this, what they're calling the public option, so different than the exchange, because the exchange, they're not government negotiated rates, and carriers have to provide the same plans on the exchange as they do off of the exchange. So this would be different through the public option. That's where they would have the government negotiated rates. And the concern here is that there could be some negative effect on the private market if they're not able to compete with those government negotiated rates. And I apologize, there is a helicopter going by. Hopefully you don't hear that in the background. I apologize if you do. I am in downtown DC, so I think it might be the president or someone else from the administration. So we'll wave to them from here. And then Medicaid for all is the last example that is a little bit different. And here it would allow states to open up their Medicaid markets for folks to buy into. So I just want to make sure that we understand that there are some differences there. So when we talk about this and how this could affect the election, I do want to reflect back onto the midterm elections where there was a lot of attention on Medicare for all and a focus on some of the Democrats running, and there was a perception that all of them are in favor of this, and that is really not true, and I want to point that out. So when we look at the numbers, 71% of Democrats who won in competitive elections did not support Medicare for all. And 86% that picked up seats from Republicans did not run on Medicare for all. And that means it wasn't in their ads, it wasn't in their platforms, it wasn't on their website. They didn't talk about it in stump speeches. So I really do want to emphasize that because there is a lot of opportunity for education for both parties, but really within the Democratic Party as well, even though oftentimes it isn't perceived that way. When we look at what Medicare for all would do to the Medicare market, and oftentimes when we talk about this, we say that if we go to a Medicare for all system, it's not going to be grandma's Medicare anymore. And I say that, but knowing both of my parents are on Medicare, so it wouldn't be my mom's Medicare anymore. By adding everyone onto the Medicare platform, there would be issues with lack of access to care, lack of choice. We often say Medicare for all is choice for none. Because you don't have a broad choice of plans to choose from. You don't have a choice necessarily of the doctors that are going to participate in this. There are a lot of barriers to care that come up with this. And along with those barriers, there's also a huge price tag to taxpayers, and it would be $32.6 trillion over 10 years. That's how much it's estimated that the Bernie Sanders bill would cost if it went into place. And I'll flash this up there really quick. And so this is the bill that's the $32.6 trillion. It's up $8 trillion since the last time it was introduced. And that is because of the addition of long-term care to be covered for all through the Medicare for All program that he is talking about. And I want to point out the co-sponsors on this. So you'll see in the Senate, he only has 14 co-sponsors along with him. And in the House, Representative Jayapal, she only has 106 along with her. And to get anything passed in the Senate, you need 60 votes. And the House, you need 218. So you'll see they're quite far off from getting to those numbers. And I'll also note, oftentimes, representatives or senators will sign on to a bill because it plays well for them within their home district, fully knowing that they would actually never vote to pass the bill. They just do it so then they're not asked about it anymore. They don't want to talk about Medicare for all. So they'll just do this so they don't have to be asked about why they don't support it, if that's something that's playing well in their district. So I do want to point out that even though these co-sponsors are listed here, it doesn't necessarily mean that that's how many would vote for it. And then when we talk about how much this would cost and that $32.6 trillion, the Congressional Budget Office is the bipartisan organization that determines how much a bill would cost. And it is Republicans and Democrats, folks from both sides of the aisle that are part of the CBO. And beyond just the cost in dollars, they also look at what would happen to the market in general. So, and once again, like I said, a lack of choice, access to care, possible longer wait times. And this is all caused by physicians who may leave the market because they don't want to accept what the Medicare reimbursement rates are. There's a lot of concern. I think the estimate is 10,000 rural hospitals could go out of business if this happens. So there's really a lot of concern about how this would impact the Medicare market and the market in general. So I want to talk more about the Medicare buy-in, because this is really where some people think that this is kind of splitting the issue and that the buy-in pieces aren't really a big deal, but I'm going to tell you why they're a big deal. So some of the different proposals are things like allowing those aged 50 to 64 to buy into Medicare. And so the Medicare buy-in is similar to what it sounds like. I mentioned earlier, it just allows different populations that don't already qualify for Medicare to buy into Medicare. They don't have to, but it is an option for them. So again, examples are allowing folks aged 50 to 64 to buy in, so lowering that eligibility rate or lowering the age of eligibility, allowing a public option plan to go through Medicare coverage. And again, this is a little bit different than the pure public option that I mentioned earlier. So just another iteration of all of these different things. And then another Medicare buy-in option would be to allow small groups to buy into Medicare. And as we do this, we just continue to kind of dilute what is the Medicare market, and it ends up causing adverse selection. And the market is very specific the way that it's based now. And NAHU really cautions opening up the Medicare market to any different type of population because of those negative adverse selection issues that it could create. We also caution against this because it will have the same issues that we see with choice, cost, access, all of those things for those that are already on Medicare, and then the populations that would be joining. There's also the concern about the Medicare funding, which I think is scheduled to go to not have enough funding to move forward sometime in 2040, I think 6 maybe, and so there's concern that opening up these markets, that they're not going to be able to be funded the way that it's proposed now, and the way that they would try to make up for those funds would be taxing everyone else. So a lot of concerns here on cost as well. And besides these, there are actually other bills that are trying to increase the age up to 70 for Medicare eligibility to try to help out with that possibility of ending up defunded. So arguments on both sides. And then the Medicaid buy-in there at the bottom, that would allow states to open up and determine whether they wanted to open their Medicaid markets to other populations. And so far on the state level, we have had, since the past election, more Democratic governors across the states. And so we've seen more proposals for some of these different pieces. Colorado and Washington have both passed bills for a public option. It's not using their Medicare market, though. It's setting up a separate government-run system for that public option. But neither of them have launched yet. They're still working through the process. So we'll be monitoring those as well. So now I want to shift to the actual state of the race. And we have had some development. We have some states that have already opened up for early voting. We've also had some states that have moved in where they were politically, even from the beginning of the beginning of the year. So as you'll see there, one of your closest neighbors, Florida, their forecast originally was lean Democrat, and now they're a toss-up state based on polling. So, and that is huge. Colorado moved from toss-up to leaning Democrat. So we have some states that are shifting in where they were polling politically, even from just a couple of weeks or months ago. And you'll see here, this is a timeline for the presidential debates. So the first one being next week on September 29th. And then they're spaced out about a week apart through the end of October, and then leading into, obviously, November 3rd, which is Election Day. And looking ahead to key states, and Georgia is one of them, as I'm sure you know. I'm sure right now in Georgia, if you're trying to watch anything on TV, your commercial breaks are filled with political ads. They are here too, but I think yours are probably doubled. And so you'll see here, Georgia is one of those states that allows no excuse absentee or mail-in voting, which, as we're seeing, could be a big factor in how we actually see the election turn out. And then again here, more data about those key states. Again, Georgia appearing here. And your early voting dates start October 12th. Your absentee ballots have to be postmarked by Election Day and received within 3 business days of November 3rd. And you'll see there the hours for your polling places. And so looking at the policy platforms, and when we talk about Joe Biden and his platform, and specific to Medicare, he does support Medicare, similar to some of the items that we saw in President Trump's executive order. So Joe Biden, by no means, wants to deconstruct the Medicare system. He is definitely a supporter of Medicare. And I'll also point out, as much as we heard in the primaries on the Democratic side about single payer versus Medicare for all, Joe Biden was not in the Medicare for all kind of bandwagon. He would like to see an extension of the ACA, and he has talked about lowering the Medicare age to 60, so we do caution there about possible adverse selection for lowering that age and allowing a different age group into that population. And then he's also talked about possibly putting together a public option, a Medicare type public option. So again, where they would have government negotiated rates with different carriers, but not through Medicare. So it would be another market that would compete with private insurance. And I'm going to talk a little bit later about why, even if Biden is elected, those plans are not likely to go into place. So we'll talk about that in a minute, and then we'll also talk about scenarios with President Trump. So he would also like to see Medicare be able to negotiate drug prices. This is also something that President Trump has been talking about, and we saw in those executive orders, and would like to see when that bullet there that you see, having pricing concession be passed down to non-Medicare programs. This would look at taking some of those Medicare kickback rules and applying them to the private market as well. As many of you know, and has probably been mentioned in other presentations, Medicare is often the place where things are tested out. It's a market that the government likes to test things on. Things like value-based design, reference-based pricing, are all things that were tested out in the Medicare market before going to the private market. So here, he would like to see using those items on Medicare and then spreading them over to the private market as well to see those lower drug prices. Outside of Medicare, he'd also like to see surprise billing, a prohibition on surprise billing, and to bring back the individual mandate that was zeroed out by that December 2017 budget bill, and is now being litigated and will be before the Supreme Court later this year. On President Trump's side, he would like to continue efforts to limit the implementation of the ACA. We've seen a lot of action there throughout the past 3 years, almost 4 years. He would like to proceed with those drug pricing rulemaking, so enforcing those executive orders and having the agencies release proposed rules. And as I mentioned before, a lot of those are specific to Medicare, allowing the drug reimportation, having international drug index pricing on Medicare Part B and Part D. All of those would lower prescription drug costs. And he would also like to see Congress take action on drug pricing. We did have a few bills that were introduced that would have affected the cost of pharmaceuticals for Medicare. Unfortunately, they just were not able to pass both the House and the Senate. There's one bill that passed the House, one that stalled out in the Senate that actually had some likelihood of passing. And so President Trump is saying he would like to see Congress support this as well. And then he'd also like to combat surprise billing. And we could actually see an executive order on this possibly later today or tomorrow. There were some whispers about that. So stay tuned for MiniHU and we'll let you know if we get anything on that in the next couple of days. And so heading into the presidential election, these are the polls. These are from earlier this month. And again, we know from past presidential elections that the polling isn't always reflective of what we're going to see in the voting booths. But right now, Vice President Biden is polling a few points ahead. But again, this was from earlier this month. And here are the the Electoral College projections. 270 is the electoral number you need to win. Right now, again, Vice President Biden is polling ahead with Democratic states for the Electoral College votes. It's a mouthful, but this is from earlier this month, and with everything that's happened in DC over the past couple of days and weeks, we could obviously see some of these pieces change. So then shifting to the House and the Senate, and this is really where I'm going to talk about the different types of combinations that we could have as far as who's in the majority, who's in the White House, and what that means. So right now, we have 232 Democrats in the House and 197 Republicans. For the House, the magic number to get anything passed is 218. So you need 218 votes to get anything passed in the House. And remember, just a little reminder for your Civics 101, the representatives run every 2 years. So everyone in the House is up for re-election right now. And the projections here are for 221 Democrats and 186 Republicans, with 28 toss-ups that just are not able to be determined right now. And here you'll see with that magic number of 218, it is likely that the Democrats will have a majority, but it won't be a very large majority. It's going to be very slim. And what this means is they're going to have to need bipartisan support to get anything passed. And remember when we had those slides up earlier with the most popular Medicare for All bill, and in the House, they only had a little over 100 co-sponsors, and not even all of those would have voted in favor for it. So it's not likely, even if we have a Biden presidency, that the Democrats would even put a Medicare for All bill to the floor for a vote, knowing that they're not going to have votes to spare. They would really have to work very hard to try to even get to 218 to get that passed. And so with something that is as monumental as that, they do not want to have votes going to the floor that aren't going to be beneficial for them. So they're not going to put something on the floor knowing it's going to fail, knowing that it's going to cause a stigma against that bill several years down the line. So for this next congressional session, and even the following one, regardless of who is in the White House, we are not going to see the House put a Medicare for All bill to the floor. It's just not going to happen. On the Senate side, we currently have 53 Republicans and 47 Democrats. And remember, the Senate, their terms are for 6 years. They're not all set at the same time. So right now, there are 35 seats that are up for election. 12 of them are currently held by Democrats, and 23 are currently held by Republicans. And the projections for right now are for 47 Democrats, 47 Republicans, and 6 toss-ups. So it is anyone's game. However, there is a large chance that we could actually see a 50-50 split here in the Senate. And the magic number in the Senate is 60. You need 60 votes to pass anything through regular order. So you'll see here, even if one party gets all 6 of those toss-ups, neither party is going to have 60 votes in the bag. There are special considerations where if a bill is related solely to the budget, that the Senate will be able to pass it through what's called reconciliation. And under those rules, they would only need a simple majority or 51 votes to be able to pass it. But those are very special rules for very specific bills. So for regular order, again, they would need 60 votes. And so here, again, when we look at things like Medicare for All, which is probably the most threatening to the Medicare market, we're not going to see this as a vote in the Senate, because there's no way that they're going to get to 60 votes with the projections that we have. And it's really unlikely that that these projections here are going to be so far off that we will see a Democratic majority of over 60 in the Senate. It's just not feasible. So once again, regardless of who we have in the White House, we're not going to see a vote on this in the Senate in either of the next 2 congressional sessions. And I say this, but also wanting to set things up for the future. So as much as I am emphasizing that the likelihood of this is almost 0, I do want to point out that NAHU is continuing to message on all of these pieces because we know that we need to work ahead. So we need to go ahead and work several years down the line. So in the event that a public option is voted on in the House, it probably won't pass the Senate, again, because we see here it would be so tight. So even if the House does have a Democratic majority and Joe Biden is in the White House and he proposes his public option, it's not going to get past the Senate. But we do know once those ideas are out there, and if they pass one chamber, they do gain traction. And the other chamber is looking. The Senate's going to be aware of what's passing on the House side. So we want to make sure that we're messaging on this, so that we're messaging for when there is a time sometime in the future where, because this is so much backed by the Democratic Party, that if they do have the White House, the House and the Senate with such a large majority that something like this could pass, we're messaging on it now so that we have those moderate Democrats that understand why it's important to preserve the Medicare market, not just for those that are on Medicare, but also the importance of preserving the employer-sponsored system, which I do talk about quite a lot in other presentations, but here obviously focusing on the Medicare market. So different resources that we have at NAHU, we do have our compliance corner, which allows for you to message us with different questions you have. And here we do cover the Medicare market as well. The Medicare newsletter is a quarterly newsletter. There's one that's actually going out, I think, later this week or early next week. Our NAHU Medicare brochures that you can download off of the website to help you with your meetings with different clients, as well as our FMO Council and Medicare Advisory Council that is made up of NAHU members that help us here in DC. So when I'm talking about our positions on different proposed rules for Medicare drugs and where we stand with Medicare for All, it's not just what I here in DC think. We are reaching out to you all in the form of these different working groups so that we have the input from you on the ground. We also have monthly calls with CMS and are going into the AEP and OEP. We are going to have bi-weekly calls with them specifically to monitor that the Medicare portal Plan Finder portal that I know was very disruptive last year. And I think John Green talked about that yesterday and the improvements that are going to be made there for the upcoming year. But we also invite you to give us feedback either by emailing me, or we do have the Medicare Plan Finder at nahu.org where you can send updates on that, as well as ways in which we support the Medicare Summit, similar to what we're doing today. You can also stay informed by listening to our NAHU podcast, our NAHU Healthcare Happy Hour. It's available on iTunes, Stitcher, and Spotify. And it goes out every Friday afternoon, so you can stay up to date on what has happened that week in DC. We oftentimes have the Medicare moment there where we update on something specific for Medicare. We also have for members the NAHU newswire that goes out every morning with Associated Press hits on everything that is important to the health insurance market. Our Friday Washington update, which is unique content from NAHU, letting you know what we have done that week and what's important here in DC, as well as you'll see at the bottom there a long list of coronavirus resources, including a Monday email that goes out with updates on everything that may have changed the previous week, from emergency rules to bills that were introduced, so you can track those and know what special rules have been put in place specific for Medicare and coronavirus. We also have our NAHU certifications that can help you to be educated on different backgrounds with things. We do have the Medicare specific certification, as well as the NAHU single payer certification, which will educate you on all of those different iterations of single payer and Medicare for All that we talked about earlier. We do often use the media and placing op-eds and letters to the editor on different issues to be able to get more attention and amplify our voice here in DC, as well as our Political Action Committee, HUPAC, which helps us to support those legislators that support us and our industry. So I do urge you to contribute to the Political Action Committee and HUPAC, and I'm sure that Georgia has a chair that will be happy to take those contributions. And with that, I will open to questions. I'm not sure, let me see if I can open up the chat here. So I see one question here with transparency and how relevant is the issue of transparency, and it is very relevant. What we have seen over the past couple of years, we did have a number of proposed rules on price transparency, both for hospitals to be transparent on their prices, as well as carriers to be transparent in coverage, even requiring up to the minute updates in where someone is in their coverage or in their deductible and their copays. all of these transparency rules that were put into a final rule are going to be implemented at January 1 of 2021. There have been court challenges to these most recently, and I think the only rule that has had a hearing in regards to transparency was the hospital transparency rule. And that has been heard by a lower court that ruled in favor of the Trump administration. So there is going to be an appeal, but for right now, that rule is in place and is on track to be implemented at the beginning of 2021. And then I see another question: is the direct primary care model a viable replacement of the current model? The commenter includes the present model is broken and not sustainable. And yes, direct primary care is getting more and more popular. There was actually a recent proposed rule that we commented on that would allow for the use of HRAs and possibly HSAs to be used for the cost of direct primary care. NEHU, in speaking with our members, found that most of our members are in favor of this and do believe that it would be beneficial to their to their clients. And so that we did comment in favor of this. And from what we've heard with the administration, from the other comments that were received, it is very likely that this is something that will be put into a final rule possibly by the end of this year, with an implementation date to follow. And I don't see any other questions. Donna, I want to check with you to make sure I'm not missing other questions.
No, I don't see any more either, Marcy.
Okay. Oh, I think one just popped up. Okay, well, Donna, if there aren't any more questions, I will turn it over to you.
All right. Well, thank you, Marcy. That was a ton of information, and we really appreciate you taking the time to be with us today. That was some stuff we all need to know, and I'm sure a lot of stuff that we didn't know before. So very good. Thank you very much. Okay, everybody, next up is a 30-minute lunch break, so you can run out and grab something to eat or run to your kitchen or whatever you're doing for lunch. Our next session is at 12:30 and will feature Andy Neary, who will be telling us how to have a major league mindset. You don't want to miss that one. So be sure and be back at your screen by 12:30. And thank you for attending and enjoy the rest of your day. Thank you, Marcy.
Thank you.